Obsessive-compulsive disorder. Origins, causes, and treatments. Obsessive-compulsive disorder is a mental disorder that involves a person with unpleasant and disturbing thoughts, fears, or images, obsessions, and repetitive behaviors to reduce the anxiety caused by these thoughts, compulsions. In this video, we will examine how obsessions are formed, the factors that affect them, and the various roots of this disorder. How obsessions are formed. Obsessions usually begin with magical and symbolic behaviors to protect against anxiety, danger, or feelings of guilt. These behaviors are learned from childhood and from those around them. Many of these reactions, which are initially used as a response to control stress and anxiety, over time become repetitive and obsessive behaviors. Some of these behaviors have their roots in evolutionary patterns. For example, our ancestors used magical practices to survive in dangerous situations, which over time have taken on a more modern form and are now known as obsessions. The main mechanism that stabilizes obsessions in a person is negative reinforcement. That is, by performing the obsessive behavior, the person reduces their feelings of anxiety. And this reduction in anxiety acts as a reward and reinforces the behavior in the future. The roots of obsessions. What factors contribute to its development? Obsessions are a multifactorial phenomenon that can have different causes in each person. However, some of the most important and common roots of obsessions are: 1. Fear of loss. People who have lost something valuable in the past or who are afraid of losing something may develop obsessive behaviors to compensate for or prevent it. 2. Intense guilt. This type of obsession is especially seen in obsessions related to cleanliness and tidiness. The person feels dirty and unwanted and must free themselves from this feeling by engaging in behaviors such as excessive washing. 3. Constant humiliation and blame. People who are humiliated or blamed in childhood may develop obsessions such as excessive cleaning, striving for perfection, or extreme control to prove their worth or to avoid being humiliated again. 4. Injustice and inequality. People who have been exposed to injustice and obsessions such as symmetry and excessive precision are seen. These people try to internalize a sense of control over injustice by creating balance and harmony in their environment. 5. Anxiety about harming others. This type of obsession is usually due to the person's hatred of the harm that others have done to him in the past, and has tried his best in the past not to become a cruel person himself. It appears in the form of obsessions of aggression and harm. The person is afraid of unintentionally hurting others, and to ensure this, he performs behaviors such as constant checking or avoiding certain situations. 6. Obsessive-compulsive disorder. In this type of obsession, The person is unable to throw away unnecessary items. This behavior is often caused by fear of the future, poverty, or feelings of insecurity. Treatment of obsessions. How can these behavioral patterns be changed? Therapeutic approaches to obsessions should focus on the deep roots of this disorder. Simply trying to eliminate the obsessive behavior without addressing its root cause often leads to failure in treatment. Some effective methods for treating obsessions include 1. Cognitive belief restructuring. Many people with obsessions have distorted cognitive beliefs about morality, danger, or control. For example, someone who feels intense guilt is usually at a lower level of moral development, such as the good girl, boy stage in Kohlberg's theory of moral development. Improving the person's understanding of morality and accepting that it is relative can help reduce guilt. 2. Acceptance and exposure therapy. This method is one of the most effective treatments for obsessions. In ERP, the person is gradually exposed to anxiety-provoking situations and is trained to manage their anxiety without engaging in obsessive behavior, changing the meaning and past false beliefs, and creating positive and effective beliefs. 3. Working on personal identity and letting go of past humiliation and guilt. People who have become obsessed with past humiliations need to rebuild their identity and understand their personal values, independently of the judgment of others. 4. Accepting reality and managing anxiety. For people who have become obsessed with a fear of danger or loss, increasing awareness of the unpredictable nature of life and practicing accepting reality can help reduce their anxiety. 5. Changing obsessive patterns in the family. In many cases, obsessions are passed down from generation to generation in families, not as a genetic factor, but because of similar behavioral patterns. Examining family history and identifying incorrect patterns can help change them. If this article was helpful to you, follow the Effective Psychotherapy channel.